Today we're going to talk about the comparison of having your joint replaced versus stem cell therapy. At jointhealing.net, we really tout cell-based therapies. But I think I come from a unique background in that for over the past 25 years, I've replaced thousands of joints. So I know all about joint replacement. I've done a full year fellowship in joint replacement. And so I have this unique perspective to identify who's the correct candidate for a joint replacement versus cell-based treatment. So right away, cell-based treatment is not for everybody because we're correcting a biochemical problem and not a biomechanical problem. So let's kind of go over the basics of who is not a good candidate, and that would be somebody who has a severely bowed joint. So if it's more than 10 degrees, which we can easily tell you, you may not be a good candidate. If you've lost more than 20 degrees of the normal range of motion of that joint, now that's become a dysfunctional joint and you may not be a really good candidate. If your knee or your other joints have a lot of problems with instability, you still may be a candidate, but those have to be addressed first. And then finally, if your joint, such as your knee joint, swells up so much that you have to have it drained 4 more times a year, that tells us that the biochemical process there is so out of whack that you may not be a real good candidate. So right then and there, we've identified some people who are good candidates and not good candidates. But now, say that you don't have those 4 things. So what would be a better choice for you? And that's what we will help walk you through. So there's some basic things here. First of all, we have to compare the difference in pain, because that seems to be the biggest question that people have. So with a joint replacement, you're normally admitted into the hospital, usually just about a day right now, and you're given narcotic medications that usually last about 4 to 6 weeks to help control that pain over that period of time. A cell-based treatment, depending on what you have, you may only need any type of pain medication for 1 or 2 days. Some people don't even use it at all. Next, we can talk about the rehab portion, because you have to rehab yourself after each one of these procedures. So with a joint replacement, you're going to need a lot of rehab. Your success is very dependent, especially with a knee replacement, on your compliance with rehab. And not only just physical therapy, but occupational therapy. And that usually requires about 2 to 3 times a week for about 6 to 8 weeks. Now, on the other hand, cell-based treatments, you can do a home program. It takes you about 10 to 20 minutes a day, but it's real simple, such as getting on a stationary bike or going for a walk and doing a little bit of quad set exercises. So that's all done at home in the convenience of your home. So the rehab is a lot less intensive. Also, we have to talk about scars, because a lot of people get concerned about scars. So if you have a joint replacement, there's no way around having a scar. Now, we can make it look real good. It can be a little bit smaller, but it's still about 6 to 8 inches. Now, with a cell-based treatment, you're maybe talking about little puncture wounds that you may have from where we get the bone marrow from, and sometimes around the joint itself. But those heal up by themselves. There's no visible scar that you can see after a few weeks or a few months. And so there's really no scarring there. We can also talk about the complication rates between the two. Now, when you have joint replacement, traditionally, a lot of large studies looking at hundreds of thousands of patients at a time have shown that the complication rate varies from anywhere from 3% up to 16%. And the things like blood clots and infections and loosening of the component can all happen. But with cell-based treatments, it's under 1%. The most common being bruising. Other things that can occur are also blood clots that can occur from these procedures, and theoretically a case of infection. Although that I've never seen that occur, and only seen 1 case reported that. And also there's a slight potential for temporary nerve damage. Also, the complication rates for joint replacement seem to be related to other comorbidities. Those are other conditions that you have. So your age, your weight, if you have things like diabetes, a heart failure or a previous stroke, those all increase your risk for further complications after this procedure, and that's not really true with cell-based treatments. Also, the convenience. Joint replacement requires you to be dedicated to getting yourself better, usually over about a 3 to 6 month period, and that's per joint. So if you have 2 knees that are bad, you really bought yourself about 1 year to 2 years of recovery, because you have a couple of visits with the orthopedic surgeon. You have to go to the hospital for a preoperative evaluation, sometimes to your primary care physician or a specialist to get cleared. And then you have multiple physical therapy visits. Also, you have follow-up visits with your orthopedic surgeon. But with cell-based treatments, you have basically about 4 visits, 1 to be evaluated, 1 for the treatment, 1 for sometimes a follow-up treatment that's done, and then an evaluation at 3 months, 6 months, and a year. So it seems to be a lot more convenient. And also with joint replacement therapy, you need to inconvenience somebody else, because you're going to need to have somebody else take care of you all 24/7 for about 2 weeks. But with cell-based treatments, you may just need somebody to drive you home that day, sometimes stay with you overnight. Now we get to the sticky part about cost, because it all comes down to the mighty dollar, doesn't it? So a joint replacement costs about $35,000. And that is normally covered by your insurance. But if you have deductibles, if you have co-pays, those are normally not covered. Another thing though that has to be worked into the cost of a joint replacement is your loss of production time. So if you're working, you're going to have to be off work for a good 6 weeks. If you have a strenuous job, it may be even 3 months. With cell-based treatments, they can cost anywhere from as low as $500 to around $3,000, even up to $6,000, depending on how intricate you want to get with this. That is normally about 10 times less than a joint replacement. Now I know that you would say, well, my insurance company pays for it. But I always come back and think that there's no charity insurance company. You have to pay a premium, so you are eventually paying for this. But the overall cost to society is 10 times less with cell-based treatments given to the appropriate patients. And then finally, we got to look at, well, will this work? And although you may hear rumors that there's no long-term studies, that is false. There's actually a few very good long-term studies. One even 30 years out on a certain condition of the hip called avascular necrosis. Another one at 12 and a half years out where they compared a knee that was replaced to a cell-based treatment on the same patient. And they followed them out for 12 and a half years. And interesting enough, they found out that 7 out of 10 of those patients, when they were asked which knee they liked better, chose the cell-based treatment side. So not only do we have long-term studies, we have long-term satisfaction studies showing that this is possibly superior to joint replacement. So our own experience has been very similar to that, where about 80% of the patients improve. Only about 10% go on to joint replacement. We have a complication rate of about 1%. And that most of those patients experience 50% or more pain relief, as well as an increase in their overall daily function. So looking at the reasons above, you would have to say that if you are the appropriate patient for this procedure, this may be an overall better experience. But that decision is really up to you, and we're here to help you make that decision. Remember, these are your cells for your healing.